and welcome to NAFDAC and your else. Every week on the program, we provide you with insightful information about NAFDAC's activities aimed at protecting the health of Nigerians. I am your host, Tosin Omolaja. According to the World Health Organization, an estimated 1 in 10 medical products in low and middle income countries is substandard or falsified. In Nigeria, NAFDAC, the agency of government saddled with the responsibility of ensuring that this menace is curtailed, is relentless in its pursuit for a substandard and falsified medicine-free Nigeria.
Substandard and falsified medicines are medicines that are below what is expected in terms of the quality attributes. And the quality attributes include potency, meaning is it 100% of the drug that is there or not. It includes dissolution, if it is a solid dosage form, like tablet, capsule. How fast can it dissolve? If it doesn't dissolve, the drug is not going to release. If the drug is not released, the patient will not get the benefit. So dissolution is one key quality attribute. The hardness. If it's as hard as rock, it's not going to dissolve. If it disintegrates or gets deaggregated too fast, it may dump the drug when it's not supposed to dump the drug water. So all these quality attributes, if they are below the standards, then they become substandard. Unlike substandard, counterfeit drugs are drugs that may be generic, they may be brand name, they may even have the right ingredients, but they are now using a fake company. They are putting another name there, pretending that they are the innovator company. And even if they don't put another name there, they change something a little bit for people to think that it is the innovator company. So they are falsifying the product, but you can categorize it as counterfeiting. So counterfeiting can be for generic, can be for a brand name. It can have the right medicine, but under deceptive labeling.
All medicines can be falsified. However, investigations have shown that many of the most widely used medicines globally are susceptible to falsification by counterfeiters, including essential medicines like antibiotics, antivirals, and analgesics. In Nigeria, however, NAFDAC continues to clamp down on fake drug peddlers, counterfeiters, and even producers of substandard medicines. Upon assumption of office as Director General of NAFDAC, Professor Mojisola Adeyeye spared no time in reinstating and restructuring the agency to be able to achieve the very crucial task of eradicating fake and substandard drugs in the country.
From 2011 to 2018, NAFDAC was removed from the courts. So, if the agency that is supposed to be controlling the importation and exportation of drugs and food and other regulated products are removed from the port, Nigeria became a den of counterfeiters, a den of merchants of substandard falsified medicines. In fact, what people used to say, that take everything to Nigeria, you're not going to meet anybody there. So those years did a lot of damage. Cabals were formed, either for registered products, for registered falsified products, for counterfeiting, for tramadol, for 7 years. So what I didn't know when I was giving my resumption speech was that part of our history. Thank God, May 2018, the Buhari administration reversed it after a lot of pressure with the support of NSA, that it is not just it's affecting the health of the public, they are now using it for terrorism. because they found tramadol in the remains of some of the people that bombed themselves out. So it is not just general health, it's terrorism. So that was the corner that we turned. NAFDAC now is at the port, but we have to mop the mess that occurred over 7 years. Before the mess itself, there was substandard falsified medicines. But now, when NAFDAC was completely removed, you can imagine. But since I came, we have heightened up our investigation and enforcement. We have heightened up our activities in the state. Now that we decentralized, we have directors in the state, pharmacovigilance and post-marketing surveillance improved. But we have now changed that policy. If we have been doing 20% post-marketing surveillance, now we are doing risk-based post-marketing surveillance. So that ratio of 20 has moved to like about 80, which means we're going to be looking more into the market. So if you submit your registration product to us, and very likely to be an ideal formulation, it's okay. We are going after you as a manufacturer or marketing authorization holder in the market. So that change in our policy will greatly mitigate substandard falsified medicine.
Nigeria's dependence on imports for a majority of its medicine supply has greatly impacted on its susceptibility to falsified and substandard medicines. This also is being adequately tackled at the very core by the agency.
We import about 70% of our drugs from Southeast Asia. Last year, I took about 7 or 8 staff there. We have changed our clean report investigation analysis, inspection analysis rather, in China and India, because there were loopholes in the pre-shipment analysis. So we read the Riot Act to the CRI agents. We dropped 1 or 2 CRI agents that have been compromising. And before, the laboratories are directly under the CRI agents. Now we started visiting the labs. We wrote down the criteria that a lab must have, because in the past, a lab will say it can do this, but they don't even have any equipment to do it. So we wrote down the criteria and visited maybe about 17 labs in both countries to ensure that when results are coming from those labs, we know them. So things have been happening since our visit. The CRI agents now will tell us, oh, we are rejecting this particular product. The lab and the CRI agent, we are rejecting this particular product because the tablet is not dissolving as much as it's supposed to. We are rejecting this because there is no active ingredient in it. So it is from the pre-shipment that we are now starting, so that our level of confidence for products coming from outside will increase, or should increase. And I believe that is doing a lot for us. And then the lab, our own lab here, drug lab in Yaba, is working directly with the lab over there, meaning as soon as they finish the analysis, they send it to us. We don't wait until CRI agents transfer, so that we know what they are doing. We're also going to do risk-based categorization. We have, let's say we have 10 labs, and they are doing 8 tests. We are doing maybe 6 or 7. We will tell them, send us the results of your 8 tests. We will do the 8 tests also and validate. If the results correlate, it means that we will put those companies, those labs, in low-risk category. If the results don't correlate, we put them in high-risk category. We warn them that your results don't correlate. If you don't change, we're going to remove you. So we are strengthening it from the pre-shipment.
NAFDAC laboratories have been equipped with state-of-the-art laboratory equipment to ensure that falsified and substandard medicines are detected and do not make it to the shelves all over the country. NAFDAC's drug labs all across the country test these medicines day in, day out to verify their safety and efficacy status.
Here we are at the Central Drug Control Laboratory. This is the flagship laboratory for the agency, where we make sure that products, especially medicines and vaccines and other biological products, are tested and be sure that only good and efficacious products are released into the populace. It is our duty to make sure that substandard and falsified products don't get into circulation. And we test these products in the laboratory here. All medicines of different forms and presentation are tested to ensure that they comply with the specification in the official monographs. If you have a tablet, if you have injectable, if you have infusions, there are quality parameters that we subject these products to ensure that only the good ones get into point of use. And there are so many quality parameters we test for, depending on the presentation or the form the product is coming from. For instance, if you are using a tablet, we want to make sure that that tablet not only contains the active pharmaceutical ingredients at the right quantity, but also that tablet will dissolve and will be available for use in the body at the right time. For instance, this device I have in front of me, we call it disintegration apparatus. This disintegration apparatus ensures that any tablet we are using, the tablet is available, is dissolved within a specific time, usually 30 minutes. And if the product does not dissolve within 30 minutes in your GIT, then that means that product is good. Even if the active pharmaceutical ingredient is okay, is according to the required level. But if it does not dissolve in your body, that means the product is not good. The same way, we have dissolution apparatus here. Dissolution apparatus ensures that tablets, when you consume that tablet, the amount of active ingredient that is supposed to be in your system within a specified amount or a specified time is available for the body's uptake. For instance, if you are taking, like this product I have here now, is meloxicam. So, and it's stated that it contains so milligram. That 15 milligram that is here, how long will it take before that 15 milligram is available for your body to use when somebody is sick? There is no point taking a product, even if the active ingredients is there, but the active pharmaceutical ingredient cannot be absorbed in the body within a reasonable time. Within a reasonable time in sufficient quantity so that the patient will get cured within a reasonable time. So these are some of the quality parameters we do. We have a lot of array of apparatus here that we use to undertake our testing. And we test products according to specification in official monograph of United States Pharmacopoeia, British Pharmacopoeia, and International Pharmacopoeia.
We'll take a short break now. Stay with us. Welcome back. The test for either falsified or substandard medicine begins with verifying that the drug contains the correct levels of active pharmaceutical ingredients required according to laid down international standards.
Substandard and falsified medicines are products we regard as products out of specification, OOS. This out of specification means that the quality parameters we test for in these products are outside the specification recommended in the official monographs. And perhaps there are so many quality parameters we look for in different products. Principally, we start with the active pharmaceutical ingredients, the API, whether the API is in the product or not, or even if the API is in the product, is it in the right quantity? Is it within the specification that is expected to be? So, substandard products can emanate from poor production, or the product could be damaged during transportation or the supply chain of the product from manufacturer to the end users. But be as it may, whether the product is substandard right from source or it got damaged during the supply chain, it's our duty in the laboratory to make sure that we test them and make sure that only fit and good products are in circulation. We use a lot of apparatuses and devices to test for different quality parameters. Here in front of me is an example of HPLC, high pressure liquid chromatography. We use this apparatus mainly to determine if the API is present, the active material is present in the right quantity in any drug presentation. A product is falsified when the manufacturer deliberately put no active ingredient or wrong active ingredient, or reduce the quantity of active ingredient in the final product. So that is, and the product can be falsified not only in the quantity, in the content of the excipient or active ingredient. It can also be falsified through the labels or package, wrong information on the package. That is complete falsification. So we check all these things in the laboratory to ensure that only fit and quality products are in circulation in Nigeria. Another apparatus we use in this laboratory to quickly detect fake, substandard and falsified products, medicines, is called the FTIR, Fourier Transform Infrared Spectroscopy. This apparatus enables us to quickly determine whether an active ingredient is present in a drug formulation or not. This device has a library. We compare the library of the spectra we are getting with the library in the software of the apparatus, and if there is a match, we know that the active ingredient is present, active pharmaceutical ingredient is present in the product. If there is no match, that means the active pharmaceutical ingredient is not in the product, and therefore the product is substandard or falsified. So this apparatus here is the latest cutting-edge technology of FTIR you can get anywhere, and it enables quick access. We can test hundreds of samples within a very short time. A good number of medicines we use in Nigeria come as injectables, such as injections, infusions, and the quality parameter, the critical quality parameter we test for all this type of product are sterility and pyrogen-free test. All injectables must be sterile. All injectables must be free of pyrogens. In this laboratory unit behind me here, we conduct sterility and a pyrogen-free test. And critically, and all, if any products, if any infusion has pyrogen in it, then that product is substandard. It will be recalled from circulation.
The negative impact of consuming falsified and/or substandard medicine cannot be overemphasized. The public must desist from purchasing medicines from unregistered outlets. Apart from the fact that medicines should not be self-medicated and should only be consumed based on a pharmacist or doctor's advice, medicines must only be bought at registered patent medicine stores and pharmacies.
People don't understand the impact or the consequences of taking falsified medicine. Let's take antibiotics. Okay, antibiotics are used for infections. If an antibiotic is falsified, instead of 100%, it's 60%. When it gets to the blood, if the therapeutic window is like this, okay, that is the window, plasma concentration, between which you can get therapeutic effect. It will be working below, the level will be below the therapeutic window. Therefore, the microbes that the medicine is supposed to kill, they just be swimming in it. And after a while, they get used to it, and they build a coat around themselves, a protein coat around themselves, so that they don't feel it. They don't feel the drug killing them. So that's part of what leads to microbial resistance, and that can kill. You can imagine if you have infection and the drug doesn't work, and they say it's the witch that is doing it. No, it's not the witch. It is substandard falsified medicines. Oxytocin is used to induce labor, to make it faster, and for postpartum hemorrhage. You have a woman that is having difficulty in delivering, and the oxytocin doesn't work. It's either the child becomes a Mongol, meaning, deficiency of oxygen during birth, and the child will have brain deficiency. The woman dies or bleeds to death because of substandard oxytocin. Many women have died. Many children have died. I almost died for my first child because the oxytocin just didn't work, and I had to get cesarean section. So that's why I take this very personal. These are very, very serious consequences that it's hard, difficult to wrap our brain around it. And that is why what NAFDAC is doing to enlighten our people. So it's extremely important to us as a regulatory agency. And this falsification is not limited to Nigeria. It is all over. It is for us now to reduce it as much as possible. This is the reason for all the efforts that we are trying to make.
On the next edition of NAFDAC and Your Health, we'll show you how the reinforcement and ports inspection activities of the agency have curtailed the proliferation of these dangerous products. Time now to bring you our weekly bulletin on NAFDAC's activities over the last week. That's on NAFDAC Updates.
NAFDAC DG holds press parley. The Director General of NAFDAC, Professor Mojisola Adeyeye, held a press parley with representatives of different media to discuss the role of NAFDAC in safeguarding the health of the nation. Professor Adeyeye also enumerated a few of her achievements as NAFDAC DG, which covers refurbishment of dilapidated laboratories, which are very essential for conducting different analysis needed on product samples. She spoke further on the creation of a new directorate within the agency to enable easy product submission for registration across the country. Under her watch, the agency's internally generated revenue also gained significant boost. Responding to a question posed by one of the journalists in the virtual press parley on the subject of as possible treatment for the novel coronavirus, Professor Adeyeye made clear that although there has been some success in the treatment of COVID-19 using chloroquine,
we are now understanding that it's not only one drug that can be effective for COVID. It depends on the stage. It depends on the phases of the phases of the disease.
Chloroquine cannot be self-medicated in the treatment of the disease, as the health status of the infected person can only be ascertained by a doctor, who will make a decision on whether a treatment using chloroquine is appropriate for the patient. That's it on NAFDAC Update. You've been updated.
That's all we have time for on the program this week. Make it a date for another insightful edition next week, same time, same station. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, please call 0800 162 3322 or email nafdac@nafdac.gov.ng. Importing, producing, distributing and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activity in your area to NAFDAC. Let's join hands to safeguard the health of our nation. See you next week. Stay safe.